First of all, thank you for inviting me here today. It's a great privilege to see the amazing work being done at the Erie Family Health Centre and to meet the fantastic, dedicated staff and the CEO, Dr. Lee Francis. I'd also like to thank United Healthcare, who very generously brought me from New York, and to thank them for their support for this event. Because of my personal experience, oral health is an important issue to me. Last fall, I decided to tell my story to the readers of Slate and learn a great deal more about the broader experience of dental care in America, especially for low-income, uninsured Americans. Too many people in this country do not have access to dental care, and unfortunately, there are more families in need than there are community dental centers like Erie to help them. Today, I want to share my experience, one that I hope lends a voice to the millions of children and families who have never seen the dentist and who accept tooth pain as a normal part of life. I grew up in a village in the north of England, a place where keeping your teeth, your natural teeth, beyond your mid-20s was seen as a bit strange. Having your teeth pulled was a rite of passage. It was what you did when you became an adult. My mom did take me to the dentist, but the culture we grew up in simply didn't value oral hygiene. I was curious and smart, but I didn't take care of my teeth. Within a few years of my permanent teeth coming in, about a quarter had been pulled or crowned with little effort made to save them. While I grew up in a different culture, low-income Americans are experiencing similar pain and discomfort because they have never visited a dentist and because oral health services are financially out of reach. So when I was young, my teeth looked terrible. I had a lot of open decay, gaps where teeth had been removed, some very large fillings, and some ill-fitting crowns. And that caused some issues. I was an odd teenage girl, but I was a teenage girl, and I was aware of my appearance. But much more disruptive than that was the pain. There are many ways of categorizing people, and I tend to divide the world between people who have experienced dental pain and those who have not. I had a lot of infections and abscesses, and I have a very clear memory of the pain that they caused. I can remember being in the middle of a conversation and being overwhelmed by a wave of pain that just silenced me, and if you knew me, you would know that that takes some doing. I remember getting one of these waves as I was walking down the stairs of the bus and not being able to continue and so missing my stop. This is a kind of pain that you can hear. It makes a noise in your head and you really can't do anything when it has you in its grip. It affected my studying and my ability to concentrate in class. But when I think about people with real responsibilities dealing with that, I don't know how they cope with the obligations of adult life, of kids, of work, and just getting things done. And when I think of how many people in America, in the communities like the ones that Erie serves, are really in a world of hurt and can't get treatment to relieve the pain, my heart breaks for them. Low-income children and families are suffering the pain I knew too well. By the time I was 21, I had started to take care of my teeth. I cut out candy, I acquainted myself with floss, and I brushed very carefully. But when I came to America, I felt very self-conscious. Americans smile a lot, and a lot of Americans have really beautiful teeth. I didn't. And like Erie's patients, I also didn't have the money to see a dentist. Or at least I didn't think that I did. If you have what is called these days a dental home, a place where you know you can go for dental care, where you'll find someone who is sympathetic and understands your needs, this may not make much sense to you. But when you know you have some problems, but you don't have a dentist, and you're not really sure how you would find one, or what it would take to sign up with them, or how you would pay them, or how much it would cost, those things can be formidable obstacles to receiving treatment. And so, like a number of people in that situation, and many of those who turn to Erie, I managed my problems, but I didn't really address them. Like a lot of Erie patients, my teeth got so bad that I couldn't ignore the problem any longer. One morning, and I guess at this point I was around 30, I coughed and I shattered a front tooth. This wasn't something that I could ignore, so I asked my boss who her dentist was, and I ended up in the office of the woman who saved my life. Now, I realize that's a really dramatic statement, but I really think it's true. If I had not been able to fix my teeth, I don't believe I could have advanced in my career. And let's just think about it for a moment, because I think this is very important. In this culture, we judge people by their teeth. When we see someone with missing or broken teeth, someone with visible decay, there's a tendency to jump to conclusions that they don't take care of themselves, that they don't respect themselves, they've made bad decisions, they're not responsible. We might also, hopefully subconsciously, respond, I don't want to have to look at those teeth every day. And people with dental problems are often self-conscious and lacking in self-confidence, like Lewis, the Erie patient, who will also share his story today. These days, we also know that a number of research studies link dental bacteria with more serious health problems, like cardiovascular disease, diabetes, pneumonia, and preterm low birth weight deliveries. I wish this research were more widely known. Poor oral health is not merely a cosmetic issue. Now, there are all kinds of reasons why people get into trouble with their teeth. They might be cultural, as mine were to a certain extent. For some people, like many Erie patients, there simply is not a spare dime in the house, or they don't have a home and just surviving takes all their concentration. They might be afraid of the dentist after a bad experience in the past, or sometimes people do everything right and thanks to genetics, they have problems. But when they do decide to address their issues and they reach a position where they can seek treatment, it's incredibly important that they can find a dental home, a place where they can feel comfortable and respected, and where they can find relief from pain and a way to reintegrate into society. I have learned today, after touring the Erie facilities, that is the facilities at the Erie Dental Center, that Erie serves as a dental home for its patients, as a place where they can receive treatment that they need and also learn about preventive oral health care. In my own case, I got a job at Slate, which at the time was owned by Microsoft, which has great employee benefits. Finally, my dentist, who I refer to as Dr. Lifesaver, could really address my problems. I had braces and gum surgeries and root canals and bridges and implants and new crowns that actually fit. And I was no longer self-conscious about my teeth. And I could chew, which allowed me to eat much healthier foods. And best of all, I wasn't in pain. This is my success story. It is the ending, I hope, that children and families who are fortunate enough to find dental homes like Erie and other community dental centers can look forward to. Dentistry is expensive. Having done a lot of research into the profession, I understand why it's expensive, but nevertheless, in the last 15 years or so, I've spent about $50,000 of my own money, that is beyond my dental plan coverage, on dental bills. That's a lot of money. And I know that I was very fortunate to have it. I also have the kind of job where I could take time to go to the dentist with a frequency that a lot of other people probably wouldn't be allowed to do. I had a dental home, a dentist whom I trusted and who was willing to take me on. But what if I hadn't had that incredible good fortune and privilege? Fortunately, amazing places like Erie Family Health Center mean that you don't have to be rich or very lucky to get relief from pain and to find a way to clear the barriers that prevent you from being able to get a job or to eat healthy food or to feel comfortable. Dentists, dental hygienists, dental assistants, the people who make appointments, the people who help patients who aren't really familiar with the dentist office, to feel comfortable and feel at home are my heroes. They save lives. They don't always get the respect they deserve, but I thank them, and I thank all of you for coming here today to support their very important work. I know you will leave the event today more informed about the issues of oral health in this community and across the country. You do not have to be a reporter or to have had serious dental problems to help raise awareness of the issue. I encourage all of you in the audience today to talk more about the problems of oral health access and affordability. Acknowledge your dental home when you go to your next cleaning. Share what you've learned today with your friends and family members and get people talking. The more awareness we can raise around oral health, the fewer people will have personal experiences like mine. Thank you.